interned in the Department of Pathology with my mentor, Dr. Gohara, and the goal of my project is to better understand the indications, procedures, and implications of these transplants. So my mentor experience. So through this experience, I learned that the Department of Pathology involves lab technicians, pathology assistants and fellows, pathology residents, and pathologists, all of whom must work together to diagnose patients correctly. So my experience involved many different activities, such as visiting the pathology labs in the basement, including the frozen section areas and the frozen section areas. I also viewed and participated in many different biopsies and autopsies. And on a daily basis, I was able to attend pathology case classes with fourth-year medical students. And I also attended well-known conferences such as the conference with healthcare staff leaders and professionals. And every day I used to go into the sign-out room, which is pictured right there, where I would view microscopic slides of tissue samples from patients and help diagnose those diseases. And then with my white cone on for every single day, I was always mistaken for a medical student. So this right here is an adaptation of one of the case studies that was featured in one of the pathology case classes that I attended. So we have a 34-year-old man who comes into the ER and he claims that he has the worst headache of his life. And so we obtain his background information and find he's adopted, he's a construction worker, and he says that he's a heavy smoker for decades, and since he does not have health insurance, he has not seen a doctor for a couple of years. And so we note that his medical manifestations include the bad headache, chronic back pain, and he also mentions that he had a kidney stone pass a couple of years ago. And so we continue on and perform a physical examination, and we note that his vital signs are all within normal limits, except that he has a high blood pressure. And we also find some anomalies, including an AV nicking abnormality in the eye, which occurs when a small artery crosses a small vein in the eye and causes the vein to bulge. And we also note that he is tender to flank palpation. So we continue on, order some labs, and specifically, we find in the ultrasound that he has large cysts in both his kidneys and his liver, and both of his kidneys are enlarged. So we continue on, and after observing all the information, the doctor diagnoses this patient with polycystic kidney disease, which is a disease that involves the deterioration of the kidney functions over some time. And so this is a figure that shows a comparison between the polycystic kidney and a healthy kidney. And you can see how the polycystic kidney just shows many cysts superficially and is much larger. And I'd like to extend this comparison with actual pictures. So you can see how a healthy kidney is smooth on the outside. It's a golden brown, it's nice, bean shaped like a lima bean, and overall just looks very healthy and smooth. And on the other hand, we have a kidney with this disease, and superficially it's showing many signs of discoloration, just different colors all around. It's not adhering as much to the bean shape as much as the healthy kidney is. You see how enlarged it looks, and then obviously there's all those cysts surrounding it superficially. And this kidney comes from a patient with what we call ADPKD, and ADPKD is standing for autosomal dominant polycystic kidney disease, because polycystic kidney disease comes in two forms, autosomal dominant and autosomal recessive, and those are just terms that describe the genetic mode of inheritance of the disease. So we continue the comparison and we slice open both of the kidneys, and we find that while looking at the interior of the healthy kidney, both the medulla and the cortex look very nice. Everything looks smooth and all the coloration is correct. Again, it adheres to the normal lima bean shape. And then on the other hand, the kidney with this polycystic kidney disease, again, does not adhere to the well-known bean shape. And you can see the after effects of the cysts that superficially occurred on the interior of the kidney. You can see all the gaps and holes. And then just the differences in the coloration are very important to note. And so overall, after some time, these patients may qualify for renal transplantation if their kidneys continue to worsen over some time. And so renal transplantation is undertaken by these polycystic kidney disease patients and also patients with a condition known as end-stage renal disease. And overall in America, over 80,000 patients are on the wait list for a kidney transplant. And some studies have actually shown that having a kidney transplant extends the patient's life longer than dialysis treatment would. And so we have to note the indications and contraindications for a patient before they can get a transplant. And so basically the main indication for a renal transplant is the chronic renal failure. Again, just the deterioration of the kidneys over time. And then contraindications tend to be like any cancer or infection that might spread from one location in the body to another location in the body, which would of course create some complications during the surgery and afterwards. Other conditions are on the list, such as hepatic insufficiency and severe cardiac or peripheral vascular disease. And also, any issues that will remain stagnant or exacerbate after the transplant are considered contraindications. And again, the patient's inability to comply with the treatment area would also produce a contraindication that would actually stymie the progress of such a transplant. But before a patient can be even given a transplant, they must undergo the pre-transplant panel-reactive antibody testing, or PRA testing. And so PRA testing reports the sensitization of the individual, specifically to the HLA antigen, or the human leukocyte antigen. So basically, the doctors will take some cells that contain this antigen and insert these cells into the patient's body. And so these cells are monitored, and we see how many of the patient's own body cells have killed off these HLA cells. And then we report this number from a scale to 0 to 99%, with the higher percentage equating to a higher number of cells that have been killed off. And so a higher number of cells that have been killed off, a higher percentage, indicates that this person has been exposed to various foreign particles in the past and has thus developed some antibodies to these foreign particles. And this is important to note because a higher percentage heightens the patient's risk of rejection for a donor organ, which is something that is very necessary to know before a patient goes on to the procedure. And so the procedure occurs in around 6 steps. So the patient will come into the operating room, and they will be hooked on with a gown, an IV line, and catheters. And then, of course, the anesthesiologist will put the patient to sleep and monitor the patient throughout the whole surgery. And then the doctor will take an antiseptic and clean the surgical site with the antiseptic, and then cut into one side of the lower abdomen. After inspecting the donor kidney, the doctor will then look at the kidney and sew the kidney in the patient's body with its respective arteries and veins connecting it. And then blood flow through the arteries and veins is monitored to make sure that everything looks fine. And then afterwards, the ureter of the donor kidney is fused with the bladder of this patient with either the staples or the stitches. And then after everything looks fine and everything is working out, the doctor will conclude the operation by sewing everything up and applying a bandage. And then afterwards, this is what exactly it would look like in a patient's body. You can see this is a picture from kidneys, with kidneys and original kidneys right here, and those are small kidneys, small because they have deteriorated function. And then afterwards, we had transplanted a kidney in this person, and so basically this is what it would look like in the patient's body. And then following this procedure, the patient now has a kidney that can effectively filter their blood and making their life 1,000 times easier. And then, of course, afterwards, the doctors have to put patients on what they call immunosuppressive therapy, which are just a class of drugs such as corticosteroids that lower the patient's immune system. And as a result of a lower immune system, the patient may have several complications that might arise, such as viral, fungal, or bacterial infections, or conditions such as pneumonia. But sometimes they may even experience rejection of the donor organ. And one of the residents and I were fortunate enough to see a kidney from a person who actually experienced this rejection. So a patient came in and they had deteriorating functioning in their kidneys. And so we gave them a transplant, and 2 weeks later they began to show signs of what they call renal allograft rejection in the hyperacute form. And so we took out the kidney and we viewed it in many different points, and we saw superficially it just looks much more larger and inflamed and very blood red on the inside as well when compared to the normal kidney that we saw earlier. And then we took a biopsy of this kidney, and under the microscope we compared it to the the actual kidney, what a normal kidney would look like. And we found that the glomeruli lie in the kidney, which would be these large shapes, which are used to help filter the blood in the kidney, are actually much more enlarged in the diseased kidney, as you can see. And we also know that the tubules, which are necessarily considered vacant in the normal kidney, are actually filled with fluid in the diseased kidney. And overall, you can look how the diseased kidney shows signs of what they call hemorrhage because of the darker color of the biopsy when compared to the normal kidney. And then all of the blue dots that are shown in both of the pictures are inflammatory cells known as lymphocytes. And in the normal kidney picture, the inflammatory cells are uniformly distributed, but when you look at the diseased kidney, the lymphocytes are all in clumps, and so that indicates that the patient has signs of inflammation in their kidney. But overall, this procedure is very, very successful, with percentages of success rates in the 90%, and overall it's a very good procedure. So these are my references and my future goals and accomplishments. So through this program I gained wonderful hands-on experiences in the medical field and learned valuable information about the field of pathology. And so my future goals are to attend college after my senior year of high school, attend medical school, and either become a pathologist or a practicing physician. So I'd like to acknowledge a number of people for the success of this program. I'd like to acknowledge the REACH program coordinators, Ms. Peterson and Dr. Hogue. I'd also like to acknowledge my wonderful mentor, Dr. Gohara, and her secretary, Bray Hayes, for always being there. And then a number of pathologists and assistants and residents and fellows that I listed on the slide. And then the house supervisor and endocrinology professor, Ms. Ackerman and Dr. Coker, and all the REACH participants for always being there and aiding in success of this program. So thank you all.
I have a question. Once your body rejects one kidney,